Hello, precious mamas and mamas-to-be. Welcome to my mind-opening interview series with important authorities in the birth world. This is your host, Ilka B, with the Liberated Birth Movement, broadcasting from around the world. In this interview series, we're going to once again uncover myths, ask interesting questions, and get out-of-the-box answers.
Hello, hello, you all precious mamas. I am super excited to have the legendary Hermine Hayes-Klein. Oh my God, now I'm like all thrown up.
Hey, it's okay.
On my interview today, she is a lawyer and she is also an advocate for human reproductive health and maternal health care. And I believe we met a few years back at Gina Gerby's Flock Year conference in San Francisco, right?
That sounds right.
Yeah, I think that's where we met. And you actually blew my mind, I gotta say, because you had this amazing speech about midwifery and the history of midwifery and women. And I was just sitting there and my jaw just dropped and I was like, oh my God, I need to meet this woman. I need to be friends with her and I need to follow her. All her work and everything she knows is what I need to know. So I'm really excited to have her on today and ask her some really good questions. For all of you ladies that are considering a home birth or considering a birth outside the hospital. So welcome.
Thank you, Ilka. It's a pleasure to join you.
All right, so let me ask you how, tell me a little bit about your background. I just said you're a lawyer, but what are you really truly passionate about?
Okay. Well, I'm a lawyer indeed, and I guess I'm passionate about justice and peace. I know it's a cliche, and I guess the applications of that to sort of trying to end old entrenched inequities, which of course, as you know, can include national inequities and racial and ethnic inequities within nations and between them. But the fundamental inequity, historical inequity that I work on is sex and gender, sort of the relationship between men and women and the state and sexuality is what I really care about. And so earlier in my university days and my 20s, I really looked at that through the lens of sexual violence and sort of how the law related to sexual violence. There's this thing of violence against women, and then what happens when women try to get accountability for the violation of their sexual autonomy, and when would the law protect them and when would the law not protect them. When we look at that kind of thing historically, it sheds a lot of light on women and our ownership of our bodies and our experience of them. And then in my mid-20s, one of my girlfriends was pregnant and she asked me to read Ina May's Guide to Childbirth with her just to talk about it. And that book blew my mind, just to read all of the birth stories and to sort of realize how rare it was to even really hear birth stories in detail, and to start thinking, why don't women talk about this day that they went from being, one person to two people? It seems like a really important day. And then to read what she wrote about how...
Did you have kids yourself by then?
I did not. I had not yet been pregnant. But then when I read this, both starting to realize that, birth matters, that it matters in the lives of women, that they remember it, and yet that the way that they are experienced makes it something that they often don't like to talk about, and that the culture doesn't want them to talk about, because the cultural narrative around birth is that the ends justify the means. And so it doesn't matter what happens during the birth, let alone how the woman is treated. There's an expectation that she will suffer, and maybe a lot, and that it doesn't matter because all that matters at the end is that she's alive and the baby's alive. That's the only. So that for me was to realize that is sort of doesn't have to be that way. And then also to the whole second half of the book explaining that birth is powered by the hormone oxytocin, and that oxytocin is our love hormone, the one that makes us bond and attach to each other. And that this is the hormone that powers labor and birth and then breastfeeding, that it's the love hormone, and that the love hormone can actually be blocked by the fear hormone, adrenaline, and that in birth, this would actually lead the labor to stop, and this makes sense for mammals so they can get to a safe place. But then what if that anxiety that makes the adrenaline come is unremitting, right? And so then what that book sort of exposed for me was how what she reports in the book was that she had learned that when a woman feels safe, and especially when she feels loved, and when she feels that she can relax and be uninhibited, most of the time birth would happen just fine. But if a woman felt anxious, embarrassed, ashamed, anything that would make her pull into herself, internal or external,
totally.
that would literally block her labor. Yeah. And that women who were in situations where that cause of anxiety did not let up, I could see it just cast a whole new light on all the stories I'd heard from girlfriends about, oh, I went into labor was going okay. Then I went to the hospital and my contractions slowed. There was not a lot of progress. Then they moved me to C-section. Oh, this whole idea that it's mind-body, that childbirth is mind-body, not just a mechanism, blew my mind. Then I moved to Holland, and I was very blessed to happen to move to Holland also for my husband's work when I was 7 months pregnant. And I gave birth twice in a system that never moved all birth into the hospital. Holland is the only industrialized nation that never moved healthy birth into the hospital. They always saved the hospital for genuine medical need when it came to childbirth. So their whole system was based on the idea that healthy women give birth at home with a midwife. This is a normal and sensible place for birth to occur. In fact, it's the most sensible place for birth to occur because it's the home, and childbirth is a cozy home-like thing, just a totally different frame from it being a medical pathological thing. So it's a normal home-like thing, but you have these very skilled midwives who are trained to support physiology, but also recognize if a medical issue comes up, then they transfer you to the hospital or to the doctors, their colleagues, and then they meet your medical need. And Holland has always had better outcomes than the United States. So as far as safety of home birth, it's like if home birth killed babies, Holland would be the land of dead babies. And yet they've always had better outcomes than the United States, for example, and many other industrialized nations as well. And so then in that process, I got to also teach law in The Hague to students who came from all over the world. And with them, I started to look at maternity care systems around the world and how women are treated in those systems, and came to realize that women's rights were being violated pretty much everywhere. And the fundamental right that was being violated pretty much everywhere was, multiple rights, the right to freedom from non-discrimination, right to privacy, but really more than anything, the right to autonomy. The fact that even if I'm in labor, no matter what's going on, even if I'm carrying a baby, even if I need a C-section, even if there's an emergency, nothing can be done to this body without my permission. If I go to you, the doctor, or you, the midwife, your work for me. I'm not serving you. So you don't just get to do whatever you want and treat me as a means to an end in order to get the baby out of me.
But you can't believe how many women don't actually know that. In my prenatal yoga classes, there's so many women that, ask the question. We had always like a 15, 20 minute start, sharing circle. And women would always ask the questions, but what if a doctor wants to do this? Can I actually say no? Can I deny this, right? So women are really insecure about what their own autonomy in their body is and what it looks like to say no if something doesn't feel right. It's pretty shocking sometimes to see.
Yeah, exactly. Well, and the providers themselves don't know. I did a survey of, doctors, midwives, and nurses, and all different kinds of doctors, OBs, perinatologists at a bunch of different hospitals in multiple states. And I found out that, the doctors and even the home birth midwives, I would say, at least half of them didn't really, so legally there's a right answer to the question, does a woman have a right to refuse surgery, even if her baby's in danger? There's a legal right answer to that question, and it is yes. Yes, she does. And that might make you uncomfortable, doctor. That might make you uncomfortable, nurse.
Goosebumps right now. Oh my God. Yes, exactly.
She absolutely does. And then they say, but what if I think the baby's going to die? What if, well, I realize that you're uncomfortable there, but the solution to your discomfort is not that you get to impose force, is not that you get to coerce. You need to find a way to deal with that.
Mm-hmm, mm-hmm.
And so, this opens up a lot of complexities that, we can go as deep as we want to in here. But the bottom line is that these providers, and especially the nurses, truly believed that they did not get the training that helped them to understand that they can't do whatever they want to this woman. They truly believe that if they think that baby's in danger, they can do whatever that her words don't matter anymore. And so we have informed consent and refusal, which says that everybody, including pregnant people, get to make all the decisions about their body in a healthcare situation. And then the culture of obstetrics and maternity care, which is that it's still a pre-feminist model of the woman, in which she's quiet, in which she's passive, in which she lies there obediently, in which a good mother does what she's told. And then, you know, the reality that women are giving birth. Yeah, women are giving birth in that reality, in which they're still expected to be obedient, which doesn't make sense in a maternity care system that's has an unnecessary C-section pandemic. Your only shield against that pandemic is the right to say no.
Mm-hmm, mm-hmm. So when did it for you switch that you said, like, okay, I need to be an advocate for reproductive rights and maternity care, and this is my passion, and like as a lawyer I'm actually standing up towards that medical establishment, and I'm helping women to find their voice and to, you know, and stand up for their rights?
Yes. Well, so women's reproductive rights generally had been something that I cared about for a long time. And I was, you know, the director of a research center for reproductive rights while I was in The Hague. But still, the birth stuff was more of a personal and an academic interest for me. I would read while I nursed my baby kind of thing, until I gave birth with the same midwife twice in Holland. And right before I had my second baby, she got charges filed against her license by the doctors in the hospital for supporting VBAC twins in breech outside the hospital.
Okay.
And, you know, until then I didn't really know, you know, that I didn't understand that she was one of only a few midwives in Holland who would do those, you know, more complex births, who took it upon herself to maintain those skills. And when I heard that, I thought, man, I thought that I really had a choice about where I gave birth in this country. But no, it turns out I was allowed, and she's not allowed. And that's the same problem as everybody else. It's just shifting the bar for where the line of allowed. In other countries, you might not be allowed to give birth at home at all, right? And I'll be allowed because my baby's a singleton and a vertex. But that's the fundamental problem, is like, who's doing the allowing here?
Exactly. You know? Exactly.
So that's when I thought,
we're supposed to know.
She needs a lawyer. I can't be her lawyer. I don't speak Dutch and I'm not licensed here. And that's when I realized that midwives in that situation, and I knew midwives were persecuted in a lot of different places, and then women also who had experienced violence or assault or disrespect and abuse in the hospital and wanted accountability for that violation of their rights, that in that situation you really needed a lawyer that basically got it, that kind of got that there's a disconnect between sort of like practice and evidence in childbirth, as well as, you know, no, just because they're the expert doesn't mean they get to cut you against your will, kind of thing.
Totally.
And so I thought, it's time to make this my work. And so I with a lot of women in Holland, I organized a conference in The Hague on human rights in childbirth, to bring together stakeholders in maternity care, but also lawyers, to talk about human rights and legal rights as they relate to birth. Also in the hope that more lawyers would be woken up, or lawyers who have a little bit of interest could grow their knowledge and work in this area. And through that, I was able to find my midwife a lawyer who represented her through that case in Holland successfully. And then that became my work. So the next 5 years was really doing sort of nonprofit work to try to connect the women's groups on the ground in different nations that were trying to work to address their maternal health systems and advance their rights within those systems, and also try to grow and connect the network of lawyers that are doing work in this area. Because the basic idea is this will change. The rights exist, but the rights are not being respected. And that's only going to change when women speak up and demand their rights.
Exactly.
And that can only happen if they can organize to some extent together, and if they have legal support.
And if they know about their rights as well, right?
If they know about their rights, you're absolutely right. They have to know what their rights are.
Have all the support in the world, and if they don't know, oh my God, I can actually speak up and my body is my own, then nothing will actually change. So you already talked a little bit about it, but what do you think is at the current time the lack in the hospitals? Why do so many women actually have unnecessary interventions, or, you know, are bullied into cesarean? I actually quoted you the other day, and you said that there's like, sometimes obstetricians, when you heard thousands of these statements from women that actually came to you and worked with you, that said terrible things to them. Like, are you one of these women that, don't care for the health of their baby, or, no matter what you say, or if you signed the consent form, I'm still going to cut you open if I think you need a C-section, things like that. I mean, tell me about this. What is the underlying, what is the underlying lack that's happening here?
Well, so there's different kinds of issues that you're touching on here. They're even talked about in different ways by different people who look at these problems. One way to talk about it is like the disrespect and abuse of birthing women, and that can be both verbally, with abusive, manipulative, and coercive statements that are meant to get her to usually submit to interventions that she doesn't feel are medically necessary. And then sometimes actual, violence or force on her body. And that's, it can be called, disrespect and abuse. It can be called, the mistreatment of women. It was called in a World Health Organization meta-study. It can also be called obstetric violence. And the phrase obstetric violence is a name that has been given to it by the women themselves. It's interesting to think how even the sort of naming of this phenomenon, where it comes from, like the policymakers and the professionals who work on it from an abstract level, are the ones who call it, have the more euphemistic terms, like mistreatment, for example, and often because they're really sort of grounded with the providers and like really concerned about, I don't want to use language that might offend the doctors. Meanwhile, the women themselves coming out of Latin America, especially, formed the phrase obstetric violence to describe what they were experiencing, especially in these systems with 50+% C-section rates, where that's more like C-section assembly lines. They are describing their, somebody's ringing my doorbell. They're describing the use of violence on, could you hold on for a moment?
Yeah, hold on. No problem at all.
Hi.
All right, we're back.
Where were we?
Okay, what's lacking in the hospital?
Oh yeah. So there's this kind of mistreatment happens. I mean, I think a lot of times when that happens, the biggest thing that's lacking in the hospital is adequate training regarding the rights of the patient and what that means, like on a practical basis in L&D. So that's what's lacking. And because that's lacking, that training and sort of clarity around where the practitioner's responsibilities end and the patient's rights begin. So when the practitioner defines their responsibility as like to make a healthy baby, as the outcome, then they perceive themselves to be very invested in controlling the process because they have a vision almost.
Yeah.
What?
Totalitarian almost. Yeah.
Absolutely, because it's like you can only be responsible for that which you control. If I'm responsible for something I don't control, then that's an insecure place to be because I'm going to be blamed for it, but I couldn't affect the outcome, right? So when they're defining their responsibility as being the outcome, then they feel invested in controlling. And then when the subjective will of the patient, which is going to be highly variable across patients, conflicts with the provider's vision of what has to happen for a safe delivery, then they get very anxious. And when they get anxious, they can get coercive, they can dehumanize, so this is just one cause that I can understand for what's going on in that truly unacceptable dynamic, of course. And so, what's needed is a recalibration to understand what they are in fact legally responsible. In fact, they are not legally responsible for the outcome because they're not God. Nobody can be responsible for, there's no setting in which either maternal or neonatal mortality has been reduced to zero.
No.
Death can always happen in childbirth despite the best efforts of everybody involved. What their responsibility actually is to deliver healthcare services within their training and scope of practice in a non-negligent and a careful way, period. And also in a way that respects and upholds their patients' fundamental healthcare rights, including the right to say no, including the right to ask questions. And so if that was clear, and that their responsibilities truly end where their patients' human rights to make those decisions begin. So they are not responsible for their patients' choices. And it's, in terms of providers need to be protected legally, as much as women need access to accountability for violence, for example, that they experience during birth, providers need protection. They need to know that if they support your twins birth at the hospital, your vaginal twins birth or your VBAC or whatever it is, that you can't or nobody can turn around later if, God forbid, there's a bad outcome and say, you should never have allowed her to make that choice. It's too risky. She couldn't possibly have understood. And unfortunately, those cases have happened where women then turn around after a tragic outcome and say, well, if I had known, I never would have, kind of thing. I mean, it's the provider's job to give them accurate evidence-based information about the risks and benefits of their options in a non-coercive, non-manipulative way. And then it's the patient's right to make a responsibility on the basis of that information and any other information they choose to gather from any other source. Yeah. And then with the right to make that choice comes responsibility for the choice, which doesn't mean blame, which doesn't mean it's her fault there wasn't a bad outcome. Nobody wants a bad outcome, but she can't then.
Especially not the mother, right?
Yeah, absolutely. Nobody. Yeah.
Mutual responsibility that both the provider and the patient, or the birthing mother in this case, take responsibility for the experience.
Right. Which again, culturally, we have a little bit of problem with the conflation of responsibility and blame. We go right to, well, if I'm responsible, does that mean it's my fault and then I'm going to get in trouble, sort of thing. Yeah. And that's a little bit of a sickness, a cultural sickness that we can try to step out of a little bit.
So let's get into some like pretty picture, how can I say that? Okay, let me cut this out. I've seen in front of my own eyes women being like literally bullied into cesarean. I've seen nurses forcefully turn women over when women decided to, labor on all fourth, because that is how they felt more comfortable, and that was as well the way they wanted to give birth. And then nurses literally come in the room and forcefully turn her on her back. Like, what else have you seen? Give us a couple examples there to make this more clear.
So like, what does violence look like, or what does the violation of rights look like in childbirth, kind of thing? Yes, that one of getting flipped over and pinned down is one I've heard multiple times, which it's like birth like a gang rape kind of thing. And any kind of, the manipulation and like the way women are pushed into C-sections that they don't medically need runs the gamut from very light manipulation to like, oh, I thought you were, don't you care about your baby kind of thing, and this, when there's no evidence that the baby actually needs this. But for a mother in a labor state, like, what's being communicated to her there is if she doesn't obey, she doesn't care about her baby. You know what I mean? So very easy to manipulate a lot of women that way.
And imagining like a woman is in labor 20 hours. She's been working really hard. She hasn't been able to drink or eat in the last 20 hours since she's in the hospital. And then someone walks in and says, well, without even asking for consent or anything, so we're going to we have to cut you open now. It's like, whoa, what's going on here?
Yes. One way that I think about that is like a laboring woman is simultaneously at her most vulnerable and her most powerful. Mm-hmm. And the way that she's treated during that time will amplify one of those two aspects of her, either her vulnerability or her power, and therefore can lead her feeling completely weak and traumatized, or like stronger than ever and like even transformatively empowered.
Mm-hmm. Have you actually worked with women, or have women contacted you that actually stood up while they're in labor and said, I don't want this C-section or intervention or whatever, and they got in trouble afterwards? Did that happen as well?
Oh, of course, yes. Because it's like, so first comes sort of manipulation and coercion. A next level is threats, and threats can run the gamut to, I'll cut you whether you sign the form or not. So it doesn't really matter if you cut the form. If you sign the form, but like a big one is the threat to call the state to take your children. If you don't do what we say, so therefore, if you're a good mother, you'll do what we say. If you don't do what we say, that means you're a bad mother. And so if you're a bad and negligent mother, then, well, we better call the state to report on you. Then they're probably going to take the baby. So after it exits your body, they're going to take it away. And again, that's like about the most primal threat that you can make to a mammal, to take their newborn baby. And so that is extremely powerful. And I know the women who have had their babies taken afterwards. In the United States, the women who are most vulnerable to that threat being followed through on are women of color, especially women of African American descent, because the system has been taking their babies for a very long time. And so it's like almost greased. It's very easy for it to flip that switch. So, you know, and then to straight up violence and holding women down and giving them C-sections. I've heard and seen that whole gamut. Also with episiotomies. I'm working on a case right now with a young mother who didn't want pain medication. She just wanted to have a physiological labor in the hospital, and the nurse on duty didn't like that plan and wanted her epiduralized, because a woman on an epidural is a much easier patient to manage than a woman who's not on an epidural. A woman on an epidural can lie there and watch TV, and the nurse can come in and say, "Oh, sweetie, you want me to change the channel?" While a woman who's not on an epidural might be screaming at the top of her lungs, like I did through both my labors, but I was at home so I could do that. And so this young woman, she starts to moan while she's making her, while she's having a contraction, and the nurse is like, comes and like screaming in her face, "You need to shut up. There's women trying to be, you know, to rest on this floor. You need to be quiet." And she like turns on her bed away from the nurse, and the nurse comes around the bed to keep screaming in her face that she needs to be quiet and shut up because she's making too much noise. And then the nurse leaves the room and comes back with a tank of nitrous oxide. And the young woman was like, "I don't want that in here. Please don't bring that in here." And the nurse said, "Well, maybe if, you know, maybe for later, maybe you'll change your mind later." And she said, "No, I really don't want it." And the nurse said, "Well, we're just going to leave it in here anyway." And then at the next contraction, when this young woman started to moan again, the nurse came over and said, "Want some nitrous oxide?" And she said, "I don't want nitrous oxide." And the nurse like grabbed the back of her head and clamped it over her mouth and held it there while she struggled until she went limp and became a totally different person for the rest of that labor. Somebody who was compliant, somebody who was quiet, somebody whose body could be physically moved around very easily, and too traumatized during the labor to tell anybody else. So that nurse went off shift, but she didn't tell the next group what had happened, because it's like, again, you know, and her partner too, like they're like, it's their first baby, you know what I mean? They're like, "Is this how it works?" You know, and just like, we've got to get through this. We've just got to get through this at this point. But she spent the whole, you know, most of the first year of her baby's life broken, completely broken, psychologically, and it's only the preciousness of this precious loving baby that really healed her. You know, she didn't know how to bond with her baby, but he basically loved her through it, and healed their bond from what had happened around his birth.
Wow. Well, and that's just these stories. I know they're negative, but this is why I do this work, because this kind of, you know, and this young lady I talked about went to 3 or 4 different lawyers, all male, and they would, I mean, not that they have to be male, because definitely female lawyers too will cut you off and say, "Wait a second, is your baby okay?" Yeah, my baby's fine. And are you physically injured in a permanent way? No. There's really nothing more for us to talk about here. Oh my God.
And so through that, there can be no accountability.
That's why we need you in this world.
Well, and many other lawyers too. You know what I mean? Like that has to change, because essentially it's like, in practice, you know, like if there's no accountability when your rights are violated, then you don't really have those rights. Mm-hmm. You know what I mean? Then how can you say that you have? And it's similar to sexual violence, right? It's like the conviction rate for rape in the United States, at least when I was in college and studying it, was like 3% calculated by the Department of Justice. So that's 97% chance that a rapist will get away with it, which is just like, how do we talk about having the right to say no and the right to live free of sexual violence if we can't access accountability for the violation of that right? But the thing is, we do still have the right to say no. It's just that the legal system is doing a very poor job of protecting that right.
Mm-hmm. So one thing that you mentioned just now was that often couples are in the hospital, or the woman is in the hospital and she doesn't really quite know how this has to go down. It's her first baby. She might be in pain, or at least really uncomfortable. She's doing this for hours and hours. She has no idea how long it's going to take, right? There's people coming in and out the room that she doesn't know. The one person that she actually does know, her OB/GYN, most likely is not on call, or if so, just pops in here and there to say hi. At least that's my experience I had as a doula. And I believe a lot of women just have no idea how they're supposed to be treated. And that's why they're often not speak up, right? And that's why, things like that can happen. And often a lot of women don't know that they can go and see a lawyer and or can stand up and speak up to get their rights back. And the second thing that you mentioned is that these psychological wounds, besides having maybe a C-section wound or having, terrible headaches or migraines from the epidural, having, back pain. I mean, there's a lot of physical long-term side effects of these interventions as well, but most of them are actually psychological, PTSD, trauma, right? Bonding issues and all these things that can go long into motherhood after the birthing experience is already over.
Lifelong. Make every year the baby's birthday this fragmented time for the mother, where it's the anniversary of what she experienced as an assault, and it's the birthday of her precious angel. Like that. I know a lot of women who have to live with that every year on their baby's birthday.
Wow, that's really deep. That's really deep.
Yeah. Most of these injuries are psychological.
Yeah. What do you recommend to women that maybe did experience, that maybe watched this right now and they said, holy cow, this is exactly what I went through, but I try to just push this as far away as possible. I had no idea that I'm actually not the only one, but this is something that's happening, all the time, basically in American hospitals. And it happened to me. And I am the one that experiences these things, every year again on my baby's birthday. What do you recommend to a woman that felt this? What can she do?
Well, for herself, there's therapy for PTSD. So I think just even recognizing, just doing a little Googling on PTSD symptoms and so that you can just make sense of what you've been experiencing, flashbacks, triggers and all that stuff. And sort of that already can be helpful to realize, oh, I'm not crazy. Lots of people experience these kinds of symptoms after going through something like that. So recognizing that and then trying to get some support for it, which, of course, is nobody has any extra time, especially when they have babies and toddlers. But that can be super helpful. There's a website called solaceformothers.org. And that's a good website for postpartum PTSD related to birth trauma, all kinds of stuff. And they also have peer counseling to connect you with other moms, where you can all just talk it out a little bit about what you went through, other people who are going to get it. And also they have a directory of counselors. So that's when women call me about a traumatic birth, what I sort of came to realize years ago when I first started getting these calls, because I was working in this area, that their first need was usually for trauma support, and that they're coming out of it, like you said, trying to wrap their heads around what happened and what is the meaning of it and what are they supposed to do about it. And the legal system can't heal the trauma, because the legal system will probably let you down. It might not let you down, but it's like in any litigation or in a divorce or something like that, when you ask the court to solve your problem rather than say come to a mediated divorce agreement or something like that, they're probably going to mess it up at least a little bit, because they don't know you and they're doing the best they can in a short amount of time. So hoping that a justice process is going to heal it is a mistake. Although I've heard from women many times, justice is part of what I need to heal from this trauma. And so then it's well, what does justice look like? And again, going around and asking lawyers, so there's a lot of different sort of, avenues for redress for that kind of abuse. One is I'm suing them. I'm suing them usually requires a lawyer. And those are the lawyers that can be really hard to find, because they're just not used to thinking about this kind of an injury, and they're not interested. But you don't need a lawyer. Another thing you can do is file a complaint against that provider's license, or if it's the hospital that treated you this way, write to whatever your state or nation has a body that oversees all the hospitals, send them a letter. And so I think filing a complaint against the license, the medical board or the nursing board or the midwifery board, in which you basically describe what happened and its effect on you. You know what I mean? Like, how did this impact you, the way that you were treated during the birth? I think that those can be super valuable. Like, both, you should be entitled to a response from them. So if the licensing board says it's okay that they did this to you, well, that's very valuable information that you now have about the medical culture that you can then go to a reporter with or whatever, you know. And if they should hold them accountable. Now, I would say this: if you're going to your state or your nation's licensing board about a violation of informed consent and refusal, I would include the ACOG, American College of OB-GYNs, Ethics Committee opinion from June 2016 on the refusal of medically recommended treatment during pregnancy and birth, because it's a really good reflection of the law, and it makes a really good statement of, listen, doctors and nurses, no matter how scared you might be about the just, you know, effect of her decision, she has the right to make the decision. You may never force, you may never coerce. It's a really great statement. If it was the reality, I wouldn't need to work in this area. But they can take it, they can give it, because the licensing board, they themselves might not have received that training. They might not really know. They might think, oh, well, if a baby's in danger, you know what I mean? Like, that's the cultural bias. It's like, oh, if a baby's in danger, I'm sure the doctor knows that they should do what they want. And is she being unreasonable? Because, you know, when women get unreasonable. And so, you know, write it down, send it to the licensing board, and include the ACOG committee opinion so that they'll read that and be like, oh, I guess what they did was not legal or ethical.
So to summarize it, a few angles to address this.
Yes, just tell your story. You know, if that's what you want to do. If you want accountability, put that story out there. And you know, lawsuit is not the only way that you can do that.
Right, right. So first I'd say, speak up for sure. Don't feel alone. This is not something you're going through by yourself. Write it down so that you're not forgetting about it. Make sure that you get support so that you don't feel alone in this. Support from trauma support or other women that've been through the same thing and understand you. And then file against the medical board or midwifery board or nursing board or whatever, whoever violated you. And then maybe find a lawyer that can support you in that.
Right, if need be. But like you said, the first step is writing it down. And even if you don't know if you would ever want to do anything with this, you know, give it to anybody else, just writing it down, if it's spinning in your mind at 3 a.m. sort of thing, writing it down gets it out of your body. You know, so it's like you can have your little Word doc or your notebook where you write down what happened, and it just, and then when that detail comes up, you can say, oh, I already put it in there. Or if it's one that a new detail that you forgot, all right, I'm going to add it to my narrative of what happened. And another thing that I've observed about this is, like, women sometimes almost feel torn about writing down or memorializing what happened because they don't want to soil their baby's birthday. They don't want to be selfish, right? Selfish. To, like, talk about their own bad experience on their baby's birthday. And so, and they don't want the, you know, the narrative of the baby's birth to be negative for the baby, right? And so one way to think about that is, like, you can have two birth narratives. You could actually write 2 full birth narratives. The one that's for your baby, that, like, includes everything you want to share with them, and the one that's just for you about what actually happened. And even for yourself to allow that division could be a way to sort of process the sort of complexity of holding all that.
Totally. So one little topic that just came back to my mind, because you said earlier in your college days you were all about sexuality, and that is a topic that is definitely very close to my heart as well. One big point that comes up, or one big effect that this drama can have as well on women, is in their sexual life, right? I mean, we said it earlier, birth hormones are sex hormones, birth organs are sex organs, right? So it's all the same hormones that are involved in this. And, you know, imagining you're being violated in, you know, your genital area, in a very vulnerable place you're going into, like, your sex life will be affected by this. And with that, probably as well, your, you know, relationship or partnership or marriage. So these are things that definitely are not just to be taken easily and just to try to be pushed aside, but, like, this is definitely something that I highly recommend any woman to take care of. And I really like what you said. Like, I'm sure women don't want to be selfish and, like, don't want to taint the story of their baby's birth with this experience, but to really separate it and to say like, okay, this is my story, and it is important that I'm healing the story so that I can be that strong, capable, balanced mother that is able to bond with my baby. And then there's the story that my baby has.
Right. Well, yeah. I mean, and that's about recognizing it's not selfish for you to have a subjective experience. You know, you gave birth, you know what I mean? And your baby was born, and that it's all true and it all matters. But if you know, and so you can hold space for yourself as mattering. It's not selfish to do so, even though in a way, you know, patriarchal culture would like you to believe that it is, or, you know, that you should make yourself invisible. But, you know, with the sexuality, what you just said is so true. And it circles me back to your question about like what's wrong and what's going wrong in like hospital maternity care. Mm-hmm. And another answer to that question is that it absolutely cannot conceive of childbirth as a sexual experience, you know, and not just experience, but as a manifestation, as part of female sexuality, which of course it absolutely is. Mm-hmm. You know, it's like sex makes the baby pregnant.
Continuum, right.
And then it comes out the same way. And the fact that, you know, medicine can't conceive of any of this as being an aspect of sexuality is just straight up prudishness and like, you know, sort of the Christian, you know, Puritanism around that. And there, like that, some of the history there is, you know, hilarious. Like from 19th century OBs writing things like, you know, in response to, you know, of course, one of women's like top secrets is even that birth can be orgasmic, right? Mm-hmm. Which of course that it only is if a woman it's like sexuality, right? You're not going to have an orgasm if you're lying on a hospital bed with people around staring at you while you're having sex. It's not going to happen, right? And so if you're in a different circumstance, you know what I mean, going through the same process, you might, right? It's just it's all about the context. And when there was first sort of whispers around this and like and hit some of the ears of these white male OBs, they were like, there was one quote that I read one time of like, if we were to say that this was a sexual experience for the woman with the baby, or like an aspect of her sexuality with the baby coming out of her birth canal, we're gonna rename it. Look at that show. The fact that it's called a birth canal just for birth shows everything about the sort of erasing of female sexuality for childbirth. You know, it's the vagina. We call it vagina every other day of her life. And then, but suddenly for this day, we're going to give it a new name, the birth canal, so that we don't associate it with that dirty, yucky, sexy thing that freaks us all out so much. And this guy said something like, if we were to acknowledge that the baby coming out of her birth canal was like sexual, then we would have to say, put that the baby was in the role of the exciter. You know what I mean? And he was so like, oh my God, is she having sex with her baby? You know?
Yeah.
So because of that,
oh my God, we're so screwed up.
Yeah. I mean, they will literally rename your body to deny that these are your sexual parts that we're talking about here. But then you just like unpacked it there, like the way in which some women describe their experience of violence during childbirth as having been rape or having been an assault, a sexual assault. And then people hear that, they hear birth rape, and they're like, that sounds dramatic. How could they even say that? But when you think about it, like within like healthcare law and medical law, I have a puppy. I'm sorry that she's barking in the background.
Don't worry about it.
Like within healthcare law, if any medical touching without consent is an assault or a battery. So it's like if you hired me to do surgery on your left leg and I made a mistake and I do surgery on your right leg, that's an assault and a battery. Or if you hired me to take out your appendix and while I'm in there, I see your ovary looks inflamed and maybe even cancerous, I'm going to take that out too because you'd probably want me to while I'm in there. That's an assault and a battery, right? Anytime, and that sort of stuff has happened in the law, and the law is really clear. Doctors can't do that, and if they do, it's an assault and a battery. So when you recognize that, like the law has recognized non-consented medical touching as assault, then it's not hard to understand how women, like how a forced episiotomy, for example, which is a non-consented medical touching of your vagina, is experienced as a sexual assault.
Touching, but cutting it open.
Absolutely.
Yeah.
Yeah. Tearing it open. I've heard that one too.
Open. Yeah. Wow. Okay, this is all like, whew, I need a moment to just like let this sink in, because that is a lot of like traumatic things that are, being talked about right now. Let's switch it over to...
Oh, I want to answer one question that you said about like women who stood up for their rights during labor.
Yes.
I know women who've walked out of the hospital during labor. I talked to one fabulous woman recently. I don't know if I'll connect you with her. I don't know if she'd want me to say publicly her story. She's probably going to tell it publicly herself. But she had a long out of hospital labor, and she really wasn't, she basically went to the hospital just to like make sure everything was okay. Mm-hmm. But she was pretty far in labor at that point. Like the doctor started literally like checks her and is like, oh, baby's almost here. All right, let's get your, knees up around your ears. You know what I mean? And like push. And she's like, and she described how like the doctor's like, all right, we're getting her delivered, right? And they put her on her back and her knees, and that it's all happening to you, right? Like you're that, and so it's hard to even, so that she like gets up there, she finds her knees, and she's like, whoa, wait a second. And she gets up, she's like, she looks at her husband and she's like, "Are you ready to get out of here?" He's like, "Yes." They walked right out of there. They went home and and the doctor was like, her mind was blown. She was like,
nobody ever did.
I don't think you understand. You're about to have a baby. She's like, really? Oh, I do understand.
Damn. Yeah, I mean, there's this whole, new culture movement of women free birthing, right? Without...
This woman was giving birth unassisted until she got to the point where she was like, and honestly, I think she wouldn't have had to go to the hospital if she'd been able to give herself her own cervical check. The women I know who have had the most, to me, remarkable unassisted birthing experiences spent time before they gave birth really getting to know their vaginas. Mm-hmm. And like, that's a whole thing, right? Because it's like the vagina is such a taboo space that like, in every culture, like my friend, one friend gave birth unassisted in South Africa. And she said, here in South Africa, we are the most hung up about our vaginas, which made me think of like all the different nations that could say, no, we're the most hung up about our vaginas. And so like she spent all this time late in her pregnancy of like literally feeling up in her vagina and being like, whoa, like, so that's how that works. And like she could feel her baby's head up at her cervix. Mm-hmm. And so then she described how like then she goes into labor and she's in labor, and like, so then she feels down there and her baby's head was like right there at her perineum. And she said if she hadn't done that work before, she would have been like, whoa, you know what I mean? But because she had, it was like, oh, you're already right there, and she just wasn't scared. Right. Yeah. Totally. So my friend who had to go to the hospital and then leave, it was only because she was like, is there a lip? Is it getting inflamed? Like she was worried about whether there might be some obstruction around the cervix that if she kept pushing was going to make a problem.
Yeah, that's why I'm all about teaching women how to really know their bodies and to really know what normal physiological birth is, to not have that uncertainty, and through that uncertainty getting all scared and fearful, and then, buying into all these, interventions and cesarean sections because someone else on the outside tells you something's not okay with you and you don't know better, right?
So I've heard so many women tell me terrible and traumatic stories of C-sections they knew were unnecessary. The dynamic was ridiculous. And then at the end of the story, they'll say, oh, but how could I have possibly known? Like I wasn't in a position to assess whether I needed a C-section. You know what I mean? And so it's like, it's so easy to manipulate you or control you if you don't know what's going on with your own body.
I think I heard this quote, and I hope I'm saying the wrong name right. I think it's Marion Green from Indie Birth that said that. What are we losing when we're giving away responsibility to an outside source? We're giving away our own victimness. I think it's that word. I'm not sure. But we're giving away being a victim, because then we can't blame anyone else anymore, right? We have to take full responsibility if we're actually, listening to our own body, our own experience, and creating our own experience with our own responsibility. And I thought that was so fitting, right? It's like whenever we give our prenatal care away to someone else, or we give, this birthing experience away to someone else, that's when we're keeping that little bit of us that can be still a victim and can say like, but you should have known better. It's like, no, we need to take that power back and really take responsibility for our own experiences.
Totally agree. It's the difference between giving birth and having your baby delivered, right?
Exactly.
And the culture, the vast majority of the culture is set up for you just to have your baby delivered. Even like women themselves, that's the language they use. And then the baby was delivered, and And, yeah. And
with your baby, the doctor,
it's just a different relationship.
You freaking birthed that baby.
Yeah. And it's not like your choice is between doing it all yourself with no help or they deliver your baby. Like you can work with people throughout your pregnancy, throughout your birth. You can have a C-section if that's what is needed and that's what feels right for you or whatever else. And still in that process, there's a difference. There can be a difference in giving birth or having it delivered. And it's just fundamentally the relationship between the patient or the birthing woman and the providers. Giving birth means you're the central agent. You take bottom line responsibility for the decisions and they support you through with their information, with their skills to be the central agent of your care. Having your baby delivered means you show up and say, wake me up when it's over or just tell me what to do and I'll do it. And that's not, if you want to avoid an unnecessary C-section, then that's not a rational approach in today's maternity care system because there's, most of the C-sections that are given are unnecessary at this point, which is a pretty incredible thing.
Yeah. And there are like high numbers of it in America. 35% average, which means, there's hospitals that are like 60, 70%.
And that's better than many places in the developing world. In the developing world who are looking to America for, how do we deliver babies? Right. And that's where you see the C-section pandemic of like 75 to 100% in some hospitals.
Yeah. One thing that is important to me to know, because I know that I'm sure there is one or other woman that says, well, what would it help me to speak up? What would it help me to actually write this down? What would it help me to make this public, find a lawyer, fight and in the courtroom and all of these things? Give me some examples or tell me a story about a woman that said, okay, that was really hard for me, but it was really important for me and I did seek out your help or I, really took this on and I stood up for my rights. And how did it make her feel afterwards?
Well, every woman who's ever reached out to me about having been abused while she was giving birth, if I say to them, what's your goal? They always say the same thing, which is, I just want to keep this from happening to any other woman. Mm-hmm. So that's really the primary motivator for the women, for the few women who seek redress. Now, because the cultural story is the ends justify the means, most women who've been abused, if they even tell their close family members, they're like, well, doctor did what doctor needed to do. And, you might be suffering from postpartum depression, the hormones. Mm-hmm. I think it's time for you to move on. Why are you still talking about the birth?
I had to do that.
I know. Well, and it's very few women who can get past that, who are not shut down by that. You know what I mean? About what happened. But I guess I think about Kimberly Turbin, who pursued a lawsuit over her forced episiotomy that was caught on video and where she was cut 12 times. Oh. And she had to go through 80 lawyers. She was so determined to, that this was wrong. And everybody in her life was telling her, this is normal. This is birth. Her girlfriend said, well, that's what happened to me. So she was like, you all must be crazy because this is not how you treat people. And I think ultimately going through that process, and I don't want to speak for her, but having been with her for a lot of it, it seemed like it made her feel empowered. Like it just, because in fact she was victimized at a vulnerable moment. She was very vulnerable, and while she was vulnerable, somebody hurt her. Mm-hmm. And when you come out of an experience where somebody hurt you when you were vulnerable, different people have different needs for how to heal that. For some people, it's going to be using their voice, and that's really important to them. But for some people, to use their voice would make it worse. And so I would say every woman should look inside herself for what do you need? What hurts? And if sitting with this and nobody knowing about it and you being asked to move on as if it never happened, if that's what hurts, then talking about it might make it feel better. Recording it might. Right. But if it's just like, again, everybody's different. And that's maybe why working with a counselor is so important, because that person should be able to help you as an individual figure out what you need to feel better. But I think that, feeling heard and getting acknowledgement from the legal system that what you knew was not right, in fact, was not right, can be healing. Yeah. And I'm going to add this. More than that, what I've heard to be healing for women from traumatic births was making sure that they were fully supported and empowered in their next birth. And I know many women who have done that, who are like, I am not repeating that. I've seen it both ways. Some women go back to their abuser. You know what I mean? It's like, and that's an interesting thing, how the oxytocin almost makes them bond to their abuser, and like they feel loyal or they feel guilty if they leave that person. But some people have the opposite, and they're like, they just go for a totally different model of care. You know, for example, so if a woman has a traumatic emergency C-section, some women will then have a planned C-section the next time, because that feels like the most, for them, the safest, most controlled option. While some women will have a unassisted home birth or a home birth with a midwife. And, you know, everybody's on their journey and they've got to find what they want. But I think whether it's a planned C-section or a midwife assisted home birth or whatever, making sure that you are with people that you can trust. It's the most important decision that you can make for any birth, first, second, or last. Yeah. Who you choose to be there is the most important decision that you're going to make in your birth.
I truly believe that as well.
Yeah.
You got to be in a space where you feel 100% supported and respected.
Correct. In which you feel that you're the authority.
Exactly.
And to me, that's the biggest difference between home and hospital birth. You know, some hospital, they say, oh, we're making it more home-like in here to attract more of those home birthers. And what I would say to them is, does that mean nobody can enter the room without her permission? Because it's not about the curtains, people. It's not about the curtains. It's about the fact that nobody can come into that room without your permission. Nobody would think of it. You know, that's the fundamental difference between your space. You know, and some people I've heard say, oh, well, we only just moved a couple months ago. This isn't really my home yet, so it wouldn't really make a difference for me to be here. Oh, yes, it would. Even if you've only lived there for a month, it's your space and you have authority over the space, which is a totally different thing than being in a space where you're a guest and where people are going to come in and out of the room, whether you like it or not.
Totally.
Turn on the lights, right? All that sort of thing.
Yeah, and you have to be in like a gown, hospital.
All that. Pushed into a wheelchair, all that.
Yeah. Sure. Wow, holy moly. Okay, so my last question, and I ask this question every time I have someone wonderful on the interview like you are that has so much wisdom to share. And honestly, like I have like at least 3 more topics that I wanted to line you up as an interview because like everything you talked about at the Flockia conference, I thought is something that everyone needs to know as well. So who knows, maybe at some point I get you again. But okay, and I hope you will stay with us for forever. But if you would, for some reason, leave Earth tomorrow and you would have one last important message to share with humanity, what would it be?
Well, you know, I would repeat the cliches of our ancestors that all we're here to do is love each other. I think that's true, and that's actually borne out by the fact that the love hormone is what like powers our like arrival on this planet. So we're really here to love each other, and that's never going to happen. We're never going to live in the paradise that we've been given unless women are fully in their power. It's just not going to happen unless that bond of the mother and baby can really be in a fully empowered state, and where women are living in their full strength of their sexuality, free, without violence around sexuality for anybody.
Wow. Thank you.
Women have to be empowered for us to live, to sort of enjoy paradise. And our patriarchy was one of our biggest mistakes.
True. Very true.
Yeah.
Hermine, so give me a little, you know, how can we reach you? What are you speaking somewhere? Are you giving workshops? How can we learn from you? Are you having any sort of online course, or how can
one day? For now, I'm focusing on my cases, and now and then I have a chance to speak. I was just invited yesterday to speak in Canada for the Alberta Midwives in September 20th, and then maybe another thing in late October. But I mean, I have a Facebook page.
Yes, Facebook. Do you have a website as well?
I mean, it hasn't been updated in 5 years. It's on my to-do list. I have a hayeskleinlaw.com. It's very much out of date.
Okay,
really bad.
Way to connect with you is through Facebook?
I'd say Facebook, but of course you can also email me. My email is Hayes-Klein, HAYESKLEIN @gmail.com. Okay. And yeah, just it's a small world now. We can all find each other if we need to.
Perfect. And you know, if any woman needs you and for any reason you don't have the time, I'm sure you will find a good person for her to recommend or get in touch with that can.
I know I will.
Speak
absolutely.
Yes.
Yeah.
Women need to be empowered, and thank you so much for doing the work you're doing. It is so powerful and so needed, and so I'm so grateful to just know that you're out there fighting for women and to give women this platform to speak up, and not just, you know, against the social against the justice or for justice better, but rather also, like, you know, knowing that they're not alone, and having that community and knowing that they're supported through people like you. So thank you so much for taking your time and speaking with me and sharing your wisdom and your knowledge, and keep on doing the amazing work you're doing.
You too. You too. Keep me posted.
Will do. Thank you so much.
Thank you, ladies, for joining us to this great interview. If you enjoyed this, please follow the Liberated Birth Movement on Facebook or subscribe to our channel. If you have more questions how to apply these ideas to your pregnancy and birth, schedule a call and we'll get you clear on what you want and how to get it. meetme.so/liberatedbirth. meetme.so/liberatedbirth. Always remember, birth belongs to women.